let's go to Saskatchewan in Canada to look at how COVID-19 is impacting older people in that country and what Nigeria can learn from Canada. And joining us is an associate professor of surgery at the University in Saskatchewan, who is also the president of the Canadian Association of Physicians and Dentists, Dr. Adeyemi Laoshibikon. Good evening, Dr. Laoshibikon. Thank you for your time.
Good evening.
Now, what kind of caregiving do the elderly get in Canada? Is there anything specialized or specifically designed for them?
Thank you very much for that question. The elderly are managed basically the same way we manage everybody, with a lot of emphasis on prevention, knowing fully well that the elderly are very vulnerable to severe disease if they catch the infection. We put a lot of emphasis on preventing them from catching the infection in the first place. So apart from the general recommendations of hand hygiene, personal hygiene, good nutrition, taking proper care of their underlying medical conditions, we put a lot of emphasis on identifying specific caregivers for the elderly population, especially those who are in old age homes or long-term care facilities. During the early phase of the pandemic, we had situations where staff that worked there had job opportunities in other healthcare facilities. And it got to a point where we tried to reduce the risk of possible spread from healthcare workers to those in the long-term care facilities. So staff were made to choose where they prefer to work, and they restricted their job opportunities to those facilities. Visitors are being limited to long-term care facilities or old age homes where the elderly are, because we know that majority of the carriers are the young people that are around and are healthy or supposedly healthy. So we limit contact, even from family members, to the elderly in the long-term care facilities and old age homes.
Now, we have been told that the older people are particularly susceptible, they are more at risk because of their special vulnerabilities, which you have also spoken about. Now, given the Canadian example, but which you said, there is no special thing being done for the elderly, they're treated alongside the rest of the population. Knowing what you know about the Nigerian situation, what can you say would be a lesson or the lessons that can be picked from the Canadian example and utilized here? Because COVID is not going away anytime soon.
Absolutely right. And I think the most important message is reiterating that prevention is better than cure. We have to do everything within our powers to avoid the spread of disease to the elderly. So a lot of emphasis needs to be paid on personal and hand hygiene, physical distancing. We talked about the issue of family members and contact with the loved ones. We need to make sure that there are designated caregivers looking after the elderly in cases where they need assistance. Such individuals need to pay a lot of attention to how they comport themselves and how they move around society. We need to make sure that we have enough food supplies at home, make sure that their medications are they have enough stock of medications and don't run out. And at the earliest sign of symptoms, they have to contact the healthcare providers so that they can pick up whatever is going on early and start supportive treatment. We know that for the COVID virus infection, we do not have any specific medication for this. So we just support in whatever way we can. The intensive care unit system in Nigeria is not that well developed. We know that the facilities are not that not robust enough to manage these vulnerable people. So we need to pay a lot of attention on prevention and early supportive measures to catch and nip this thing in the bud.
Just before you go, Dr. Laushibiko, let me also ask you about your neighbor to the south, the United States. Almost 1.6 million cases now. And yet the number in Canada seems to have been very carefully managed. Does that say something about early closure of borders? What can you tell us about the general situation with COVID-19 case management in Canada?
If we look at the distribution of the disease in Canada, we see a lot of the infection in densely populated provinces. So we do have a significant burden of disease in provinces like Quebec and Ontario. As a matter of fact, about 50% of the cases in Canada are in Quebec. Now, that follows the pattern in the United States to where majority of the disease are in New York and California, where the population is very large. If you notice in Nigeria too, Lagos seems to have the highest number, and this has followed the densely populated pattern that this disease follows. So I don't think per se there's any difference in how the disease operates. I do agree that early closure of borders makes a big difference because the virus can only travel on the back of human beings. Without people passing it from one place to another, it will not move around. So whatever we can do to distance ourselves from one another at this stage is the key to treatment and prevention of this disease.
Thank you very much, Dr. Laushibiko, Adeyemi Laushibiko, Associate Professor of Surgery at the University of Saskatchewan in Canada. Thank you so much for your time. It's been a pleasure having you with us.
Thank you.
We'll take